Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Earle. As many of you know, this is the time I get to spend with you guys and talk about plastic surgery topics and, of course, answer all your plastic surgery questions, okay? I believe today is our first live on TikTok, so we're really excited about that, and we'll see how it goes, but for all you guys on TikTok that are watching this and following me, so I do this every Wednesday. It's called Hump Day with Dr. Earle, and we go over plastic surgery topics. We go over any questions that you may have. We can talk about any procedure. We can talk about pre-op, post-op, the procedure itself, what it entails, etc. So it's all about education because I feel like it's very important for our patients to know exactly what they're getting into, and so that they can then be more comfortable and also have realistic expectations as well. Okay, so today we have a very important topic because there's been a lot going on here in Florida lately. Okay, some of you may have heard this, some of you may not, but there was an emergency meeting with the Florida Department of Health approximately a week ago, or actually last Friday. And they made a unanimous decision regarding some new rules for BBLs here in Florida, okay? And we're going to get into that here in just a bit. So before we get into that, we got to look a little bit into the history here of the BBL and its mortality and why it is a bit of a controversial procedure and why it can be so dangerous if it's not performed by the right person in the right way, okay? But on the flip side, how it can totally be a completely safe procedure when it's done by the right people, okay? And the other thing I want to get into before we get started is to let you guys know about an association called the World Association of Gluteal Surgeons, okay? The World Association of Gluteal Surgeons is composed of approximately 200 members, which are the top, okay, the cream of the crop, the top BBL surgeons throughout the world. So not just the U.S., but you know, we got U.S., we got Canada, we got Colombia, we got Dominican Republic, we have Mexico, you know, people out in Europe, the islands, and really all over the world. So that's why it's called the World Association of Gluteal Surgeons, okay? And it's a very important, very prestigious society when it comes specifically to gluteal surgery. And when I talk about that, I mean probably over about 90%, meaning the BBL or liposuction with fat transfer. Of course, it also involves, you know, some surgeons that use implants, but overall that's the minority there. Okay, so if you're interested in looking that up, you can go to www.glutealsurgeons.org. I've been a member since pretty much it started, which is about 2019 or so. I've been a member of that society. All right, so, okay, BBL and mortality. So just a brief recap here. I know you guys, a lot of you guys have heard me talk about this before when I give my talks on BBL safety. But a brief recap here. So back in 2017, there was a very big concern regarding the BBL because the mortality rate seemed to be very high. So a task force was put together and they started gathering data from the US and many other countries in order to try to determine what exactly the mortality rate for the BBL was. And once they kind of gathered and pulled all that data, they wrote a paper which was published in several journals, which stated that the mortality rate for the BBL was approximately 1 in 3,000. 1 in 3,000, which is, for a cosmetic procedure, very high. Certainly the highest of any cosmetic procedure out there. Okay, and that's also around the time when the BBL started to get a very bad rap, okay, in social media, news outlets, and things of that nature. Okay, and why was this happening? Well, because before then, people were injecting the fat into and deep to the muscle, the gluteal muscle, and when you do that, there's these very large vessels there. It's called the superior and inferior gluteal vessels, and if you injure that vessel, specifically the vein, and then fat gets into that vein, the fat then travels to the lungs, essentially clogging up the lungs. It's called the pulmonary fat embolus, clogging up the lungs, and then the patient passes away, and they typically pass away immediately. okay? And so that was way too high, and so many recommendations were done at that time, and the most important recommendation done at that time was that the fat should only be injected in the subcutaneous plane, all right? What's the subcutaneous plane? What does that mean? That's the area or the space between the muscle and the skin, okay? So that's where you want to place the fat. That's the safe space right there, okay? They gave other recommendations such as that the cannula had to be a certain width, which is 4 millimeters, had to have a blunt tip, only a single hole, and that the fat needed to be placed in continuous motion, trying not to put too much fat into any one specific area. Okay, it also talked about the angles of the cannula and the angles of the patient and trying to minimize risk of trying to get that cannula into or deep to the muscle. So they did a follow-up study after, you know, taking all these guidelines into consideration. They did a follow-up study 2 years later, 2019. And in 2019, they interviewed members of 2 prestigious societies, which is the Aesthetic Society, so the Aesthetic Society of Plastic Surgeons, okay, and the International Aesthetic Society. And those are composed of board-certified, okay, board-certified plastic surgeons, okay? And these board-certified plastic surgeons had obviously seen the guidelines, followed the guidelines, and things improved significantly. By 2019, about 90% or over 90% of those that answered the survey were putting fat exclusively into the subcutaneous plane, no longer into or deep to the muscle. And so the mortality rate then decreased from 1 in 3,000 to 1 in 14,000. 1 in 14,000 is now very, very acceptable. This is very similar to the mortality rate for a tummy tuck, actually a little bit less, okay? So now we are in the acceptable range right here, but this doesn't go for everybody, right? It doesn't go for, say, your OB-GYN that's doing a BBL, your pediatrician that's doing a BBL, right? This goes for board-certified plastic surgeons that are part of these societies, Aesthetic Society and International Aesthetic Society, okay? So one would think, problem solved, right? We would follow the guidelines, things are better, same as the tummy tuck, problem solved, right? Unfortunately, the answer is no, okay? Unfortunately, the answer is no because A, not everyone's following the guidelines, B, not everyone's being a board-certified plastic surgeon, and you know, you have people that are not trained, that are not prepared, that perhaps are trying to do too much doing this surgery. And so in 2021, there were 8 BBL fatalities here in Miami, in South Florida, okay? 8. That was 2021. And quite unfortunately, so far in 2022, and I don't have the exact number here, but there's approximately 4 to 8 BBL fatalities here in South Florida, okay? Why is that? Well, because of this is that they had the emergency meeting at the Florida Department of Health last Friday, okay? And I'm gonna tell you here in just a little bit what exactly they said, okay? But just to kind of keep going along this thought, keep this in mind, okay? But keep going along this thought, we did a study with the WAGS members, the World Association of Gluteal Surgeons, okay? Who of course we take patient safety and, you know, incredibly seriously. We all have basically said, you know, are bound to using these guidelines and making sure that we're placing the fat in the subcutaneous place, okay? And we're basically a society of surgeons where we're all extremely well trained in the procedure, have a lot of experience in the procedure, and also, you know, have patient safety as our top priority. And so with WAGS members, and this is a study done just now, also 2022, mortality rate for the BBL is 1 in 26,000. 1 in 26,000, okay? So for WAGS members, 1 in 26,000, that's very, very good. That's excellent. Okay, very, very low mortality rate for this procedure. Much lower than just, simply the board certified plastic surgeons, and of course, much, much lower than things used to be back in the day. Okay, so if you're looking, one of the, as you're doing your research, and when you're looking for a surgeon to do your BBL, on top of everything else that you're looking at, okay, their board certifications, their education, their experience, etc., one of the things you may want to look at is whether they're a member of WAGS, okay? In order to do that, like I said, you go to the website, www.glutealsurgeons.org, okay? And if they're a member of WAGS, then you know that they're going to be safer than the general kind of gluteal surgeon population out there, okay? The other thing that's very, very interesting, so like I said, I'm a member of WAGS, and WAGS actually had their meeting here in Miami about 2 weeks ago, and I was asked to present on my experience here at Pure. Now, many of you know, and some might not, but I've been doing BBLs for many, many years, but in September of 2019, I started using the ultrasound for imaging, so ultrasound imaging technology for BBL. And what does that mean? Is that I use the ultrasound and I turn a blind procedure into one where you can actually see, because with the ultrasound I can see my cannula and I can see the tissues, and I can make sure that the cannula is in that safe space, which I mean between the skin and the muscle, okay? And I've been doing that since September 2019, probably the second person to start doing that here in Florida, and certainly one of the busiest, okay? Or so I thought. I thought I was maybe just one of the busiest, okay? So I was asked to present this. So we had our meeting, so can that be seen there?
Yes.
All right, so WAGS, World Association of Gluteal Surgeons 2022 meeting, which was May 26th to 27th, so fairly recent, all right? And at that meeting, as you can potentially see here, can that be seen on the screen there?
Let me zoom.
Yeah,
Yep.
Okay, look at that. Yours truly, Dr. Earle, okay? And I was presenting on my experience with ultrasound-guided BBL for improved BBL safety. Okay, and I gave the talk there, about a 30-minute talk. It was extremely well received. And what I put up there was how many ultrasound-guided BBLs I had done since September 2019. And that was about approximately 1,884. All right, 1,884 ultrasound-guided BBLs. And it turns out that is the most ultrasound-guided BBLs that any one surgeon has done, okay? In the U.S. and perhaps, perhaps the world, okay? So, so very, very well received. I've done a ton of these surgeries since September 2019, okay? And as many of you know, here at Pure, we've had zero deaths, okay? 0 deaths. All right, which is huge, okay? During that meeting, we started querying some of the other surgeons that use ultrasound BBL, and now this is an estimate. This study hasn't come out yet, but it's come out in the next few months. But the estimate there is for ultrasound-guided BBL, the mortality rate can be as low as 1 in 50,000, okay? So, which is incredible, all right? So, putting all this together, one can say that if you have the proper training, the proper experience, you have the proper safety protocols like we do here at Pure, which is not just about the ultrasound, but starts from when we very, very first evaluate the patient, okay, leading all the way to the procedure with the ultrasound. When you have all those proper safety protocols in place, plus all the education that we give our patients as well, you can bring down that mortality rate to extremely low, and fortunately for us here at Pure, to 0, okay? So, back to the meeting, right? You're wondering, well, Dr. Earle, what happened? What happened? Okay, so because of this, right, because problem not solved in Miami, they had that emergency meeting by the Florida Department of Health, and they took a vote on an emergency order. And that emergency order now limits the amount of BBLs that a single surgeon can do in one day to 3. To 3, okay? So it's a 3 max, okay? So you can only do 3 BBLs max in one day. And the other thing that they mandated is that all surgeons in Florida have to use the ultrasound. All surgeons in Florida have to use the ultrasound, okay? And for us here at Pure, we've been ahead of the game. We've been doing that for years now, okay? But so it's an emergency order, meaning that as of now, it has a 90-day limit. It hasn't been ratified yet. So, is it possible that they won't finalize it? It's a possibility. But they voted on this unanimously less than a week ago, last Friday. Okay, not ratified quite just yet. So that remains to be seen. So rumors are that it's going to be sometime next week. Okay, so now it's possible that everyone in Florida is going to have to start using the ultrasound. Okay, but while there used to be more barriers to entry, there's certainly one big barrier to entry using the ultrasound, and that's of course you need training. Okay, you can't just kind of buy the machine and then just kind of start using it on your own. You have to go to the training, which is what I did. So back in 2019, I bought the ultrasound, which is a handheld device, and then I went all the way out to California and took a course there on how to use it before I got started. Okay, and now of course I have a ton of experience with it, over 1,800 cases, probably the most in the U.S. of any surgeon. Okay, and so if this really comes into play, then there's going to be a very big demand for training in how to do ultrasound-guided BBLs. And so WAGS has decided, and along with us here at Pure Plastic Surgery, that we're going to start having basically creating a training center for this. Okay, and so based on my experience, and of course being a member of WAGS, and the fact that that just like all other members, we take patient safety incredibly seriously, I have a very big announcement to make here on our live. I'm not sure you guys are going to guess, but I was selected, and I'm very honored and very humbled, but I was selected to be the president of the World Association of Gluteal Surgeons.
Yes.
All right. Yes. Yeah.
Congratulations.
That's right.
Mm-hmm.
Thank you very much. So now, yours truly here, Dr. Earle, is the president of WAGS. Okay. That is my mission to bring, to continue to, bring this safety record to all the WAGS, to basically all the WAGS members, but to basically bring, take that and be able to then, spread it throughout the community. That's really our goal there. So, we're going to be, doing the ultrasound training, and hopefully then more and more people start doing ultrasound, and hopefully this will start to go away. Okay? Because at the end of the day, that's the goal. At the end of the day, that's the goal. The goal is to make this procedure safe. It is a terrific procedure. It's very powerful. It has the ability to, really change the shape, alter the shape of the patient, therefore empowering the patient, bringing back self-esteem, bringing back confidence. It's truly incredible what a life-changing procedure this can be. And the fact is that it can be done safely. Okay? But in order for that to happen, you have to go to the right person. You have to go to the right center. Okay? And you can start, of course, coming to us, but you can also start by going to our fellow WAGS members there. So if you're a fellow WAGS member, you're WAGS certified, that means that you've reached a certain level of safety and experience with this procedure. They should be comfortable going there. Okay? And incorporated into that kind of that WAGS certification, we are going to start doing the ultrasound training for all members. Okay? All right. Okay. happy to take any questions regarding all this. I know it's a heavy topic.
Plenty. So let's start here. Will your current schedule need to be edited to accommodate the 3 BBLs a day if the rule passes?
So fortunately, not much. So as many of you know, I've always limited the max amount of surgeries that I do to 5. And I've been doing that for, since the beginning, essentially. And by 5, I mean 5 surgeries. The BBL is not the only surgery I do. So there's maybe like 2 or 3 days on the calendar where I had like 4 BBLs, and I just have to move one, and that's it. So fortunately, we've kind of been following these kind of guidelines already. So there's not going to be very many changes for you all.
Thank you. Do you know when these laws will be in effect?
So we're not certain. So yeah, that is an important point. So there was a vote on it, but it hasn't been ratified yet, meaning that it's not in effect at this moment in time. The last we heard is that it's going to be sometime early next week. But again, don't quote me on that. I don't know for sure. But what I can tell you is that as soon as it happens, if it happens, then of course we'll be letting everyone know here through our website, through our social media channels as well.
Thank you. Not really a question, but just congratulations, doctor. Of course, there's no doctor that'd be perfect to lead a safety organization for BBLs.
All right. Thank you so much. No, it's going to be great. And then we're just going to continue to basically grow and spread awareness and education over the next year and continuing after that.
Thank you. Okay. Did you say that you've done the most ultrasound BBLs in the world? Did I hear that correctly?
As far as I know. Okay. What I can tell you is that I gave the talk there at the World Association of Glutosurgeons. I asked the general audience, and no one had done more at that time. So certainly, if it's not the number one, it's very high, very up there.
Thank you. So, little surgical question about the difference with what would you start with, at least a tummy tuck or a BBL first? What would you recommend for a patient?
Yes. So typically, for most patients, I'm going to recommend doing that tummy tuck first. Okay, tummy tuck first, I think, is very important. Why is that? Well, you want to be able to get rid of all that loose skin, right? Because when you do a BBL with loose skin, it just doesn't heal well. The skin doesn't retract well. It looks uneven, okay? And then it makes the tummy tuck afterwards, it makes it also a lot more difficult because there's a lot more scar tissue, a lot more inflammation, even if you wait, over 6 months or a year or so. So yes, in general, I'm going to recommend doing that tummy tuck first. All right, make the skin, everything nice and tight, and then come back about 3 to 4 months later to do your Lipo 360 or BBL.
Thank you. Quick comment. I foresee a new license plate coming, maybe Presidente license plate.
That's right, El Presidente.
El Presidente. Do you think is a good idea to record the fat transfer procedure?
Right, so someone's been reading up, so that is part of the language that they recommended, which again, they voted on it and haven't ratified yet. But part of the language is stating that not only do you have to do the fat transfer portion of the procedure under ultrasound imaging, but you have to record that portion as well. Honestly, I mean, I think it's going to make it very difficult for someone who's just starting to use BBL, just starting to get on board. It does kind of add another level of complexity there. But what I can tell you for us here at Pure, we're all set up to do that. So with the specific ultrasound that we have, we are able to record, and so we are able to kind of fulfill that obligation, if you will, to record when we're transferring fat, over that quote unquote danger zone area of the fat transfer.
Is there a specific technique that you like to use that separates yourself for the Lipo BBL procedure?
Well, I think it's what we're talking about. So I think, up until now, it's certainly separated because, not everyone was doing ultrasound-guided fat transfer, right? Actually, very few people were. If this does go through, then, more and more people are going to start doing it, which I think, it's something that we've been kind of talking about for a while, trying to educate people about for a while, and I think if it does if it does increase the safety of this procedure, then of course it's a win-win for everyone. But that's the technique that I've been doing, like I said, for since 2019, so about 3 years now. And that's definitely something that separated us from everybody else. And then the other thing that I started doing, and I think a bit sooner than most people, is focusing on different shapes, right? So my style has always been a little bit more of the what I like to call enhanced natural or soft vixen look, where it's really all about creating beautiful seamless transitions. So nice hourglass figure from the front, Earle curve, upside down heart from the back, and I think these are very, very beautiful shapes that are obviously also longer lasting, because I believe one of the trends that we're going to start seeing now is that those very, very, very large, very, very vixen looks with the high lats, the high shelf, that used to be done. A lot of patients are starting to come back now, wanting to reduce all that. Okay. And that's something that we're seeing, we're starting to see more and more as well. So I think I've been a little bit of a pioneer in terms of that, in terms of the Earle curve, the seamless transitions, the more enhanced natural types of look as well.
Do you foresee any long-term complications with the BBL? Anything new coming up?
Well, I mean, the only new things I think coming up are making this procedure safer, right? Like I don't certainly ultrasound I think can help, making sure that whoever is doing their surgery is aware of all these guidelines is incredibly important. And like I said, and then also the fact that now we're moving to more kind of not so drastic BBLs, all that's going to lower the complication rate for this procedure to make it safer and safer for everybody.
Thank you. Earlier you spoke about Pure being part of a training program for surgeons.
Yes.
Will that happen at your facility?
Yeah, so initially it will. So we're pretty much the pilot facility. So the pilot facility for the WAGS ultrasound training, BBL ultrasound training program. And from here, we're going to be able to train other trainers, basically. Train the trainers. And then there are going to be probably multiple facilities opening up throughout the U.S. and in some other countries as well. All kind of sponsored under WAGS. And as of right now, we could potentially have somewhere between 12 and 14 of these training facilities that are going to be opening up, I would say, over the course of the next year or so.
Thank you very much. Another question about training. Is this a live training, as you'll have surgeons in surgery with you learning your techniques, or is this kind of like a forum style training?
Yeah, it's gonna be a kind of a live training, but an observational training, meaning that I'm the one, actually doing the procedure, right? But there's gonna be people there, watching me do it. Okay. So in that sense, it's live, but I'm still the one that's actually doing the procedure itself.
Thank you. Is Vaser lipo the same as ultrasound lipo?
So no, it's different in this sense. So Vaser, it's similar and it's different. Let me put it that way. So Vaser with a V, okay, does use ultrasound waves, but it uses them in the form of energy. Okay, so it uses it in the form of energy, which actually, it can actually heat up the tissues. Okay, and so the thought behind the Vaser is that when you use the Vaser, you're heating up the tissues from the inside. That creates an inflammatory response, which then allows the skin to retract better or contract better. Okay, now that is different than what we're talking about here. What we're talking about here is using the ultrasound for imaging. Okay, so the ultrasound that we use here, we place it over the buttock, over the area where a canal is, and we can actually see the different layers of the buttock and exactly where a canal is there, and we can see that we're injecting into the right space. Okay, when you use ultrasound for imaging, there is no energy, no like heat, no energy in that sense being imparted to the tissues. Okay, So it's very, very different in that sense.
All right, we have a few questions from TikTok about.
All right, how you doing, TikTok?
Hello, everybody. Training.
Yeah.
So let me see. So you do 5 surgeries a day, no more than 3 BBLs.
Correct.
And is that the same as Dr. Vidal?
That's exactly right. So yeah, so it's not just about me personally, it's about Pure, okay? And Dr. Vidal and I have the same very, very strict safety protocols, okay? And we both use the ultrasound guidance for the BBL. I started training Dr. Vidal when she first started with us. Of course, now she's doing awesome. She's pretty much an expert herself, doing this on her own. But Dr. Vidal has done over 200. Already, she's already done over 200 ultrasound guided BBLs. Over 200 already. So for Pure, if you combine myself and Dr. Vidal, we've done over 2,000 ultrasound guided BBLs. Okay, and again, no death, 0 mortality rate here. Okay.
Thank you. All right, so now that you're the president of the WAGS Association, will you be too cool for us to do Wednesday Lives anymore?
No way, absolutely not. I love the hump days. Hump day, how long have we been doing hump day now?
It's 4 years.
4 years. At least 4 years,
yeah.
Right?
Mm-hmm.
Yeah, it's been at least 4 years. And we rarely miss it. I do have to take the occasional vacation, right? But it's actually, it's a tremendous, tremendous opportunity to be able to educate our patients, to of course answer, all of these kind of lingering questions. And, a lot of times maybe you can go into some sort of Facebook group or something like that and ask your question. But, here that you're getting it from a double board certified plastic surgeon. Okay. So, that you're going to get the answers that are based on my own personal education and some of the best programs out there. Go Duke. And also some of the latest kind of research as well. So up to date, factual answers here regarding plastic surgery. The other thing that I really love about our hump days is that, of course, you get to know me a little bit better, right? And I get to know you. And so we do have a lot of patients here at Pure that come from out of town, so I think it's very, very important, once you embark on the surgical journey, that you're comfortable, with the surgeon that you're going to see. And so this allows the patients to get to know me. They know kind of my personality. They know what's important to me. And so when they come here from another state, they feel very, very comfortable here at Pure.
Thank you. You said it earlier in 2017, BBL deaths was 1 in 3,000. Can you say again what's the stat currently for 2022?
So if you're talking about kind of broader, okay, so the biggest kind of study so far was the follow-up study in 2019. That's kind of the latest numbers that we have on a broad scale, okay? So on a broad scale, it's somewhere between 1 in 14,000 to 1 in 15,000, around there, which is of course much, much improved, and it's somewhat similar to a tummy tuck, okay? But these numbers here, for the WAGS members, like I said, so about 200 world-renowned gluteal surgeons, okay? When this study was performed, and this is 2022, that mortality rate for WAGS members, so specifically for WAGS members, is 1 in 26,000. Much, much less.
Thank you. Would you say that it's safer to get a butt implant versus a BBL? Why don't more people do that?
So that's a good question. So yes and no. Butt implants carry a lot of complications. Now, typically the complication is not a mortality, like a sudden death or sudden mortality due from fat embolus like a BBL. But unfortunately, it carries a lot of other complications. So what are those? So infection rate is very, very high, right? You're adding a foreign body, you're adding this big silicone implant into an area that is almost impossible to sterilize, right? Because we're near the, it's just, we're near the anus there, right? So infection rate is high, extrusion rate is high, meaning that the implant kind of pops out the incision. Because the other thing that's very, very different from a buttock implant and say a breast implant is that the area is, not completely sterile, so it's more dirty, and that we're sitting on it all the time, right? We're putting pressure on it all the time. So it's more likely to get infected, it's more likely to extrude or pop out. It's more likely to get malpositioned, meaning that it kind of moves, it shifts around, and make things look very, very, very weird. So unfortunately, a lot of patients that get gluteal implants end up taking them out for one reason or another. So it's not, that's why I would say probably 90% of the WAGS surgeons are doing fat transfer, and just the minority of them are doing the implants.
Let's see. Is the ultrasound-guided BBL going to be a requirement in Florida, or is this U.S. law?
No, this is specific to Florida. So when I talked about the meeting, it's from the Florida Department of Health. So specific to Florida, we have rules. Every state makes their own rules, right? And they're not the same. So for example, in Florida, we have a rule that says that the max amount of fat that you can remove via liposuction is 4,000 cc's or 4 liters. There's other states where it's 5,000 cc's, or maybe there's other states where there are no limits. But in Florida, it's 4,000. Another example in Florida is that if you're doing a surgery where you're cutting, right, like a tummy tuck, then you're limited to only 1,000 cc's of fat removal via liposuction. Again, that can be very, very different in another state. Okay, so you do have to look into each state's own rules. Okay, but what I can tell you though is that it pertains to all of Florida, right? There's no exceptions, right? If someone's telling you out there that they can do a tummy tuck and take out 4,000 liters, they're not following the regulations from the Florida Department of Health. Okay, so if whatever regulations they actually ratify, and like I said, this one's not ratified yet. Is it possible that they may not do it? Maybe, it's a possibility, but the vote that they had was fairly unanimous. But once it is ratified, then it does pertain to every single surgeon in Florida that wants to keep their Florida medical license.
Thank you. So of course we trust you that you're doing 5 surgeries a day, but how are they able to police surgeons to only do 3 a day? When I went and got my BBL, there was a line of 20 people.
Yeah, no, I bet. And that's that's a great question. And honestly, I would have to leave that up to the Florida Department of Health. How they're going to do that. What I can tell you is that I take these responsibilities very, very seriously. Okay, and my patients matter. And of course my livelihood matters and my medical license matters. And so, I've been doing this already, really, because that's the most important thing, right? It's not about money, it's not about numbers. It's about, patient safety, making sure the patient gets home to their families, and of course, getting great results while you do that. So we're certainly going to be adhering to whatever it is that the Florida Department of Health, basically regulates.
Thank you. All right, so many questions. We're at 40 minutes already.
Oh, nice.
So
right.
If you want to knock out some surgery questions, it's about tummy tuck lipo. We got a few.
Okay.
Can scar tissue be lipoed out from a tummy tuck?
All right. So if it's true scar tissue, then typically you're not able to use liposuction to remove that. Okay. And by that I mean like a real kind of like a scar ball, like the one that you see typically along the incision there. A lot of times, similar to like a keloid on the outside, you can get something like a keloid on the inside. It's basically scar tissue, and that has to be excised directly. You have to go in and remove that. Now that's different than, say, for example, say you had liposuction and you developed fibrosis, right? Fibrosis is a kind of scar tissue, okay, but it's not as tough basically than a true kind of surgical scar tissue. So it is possible to improve fibrosis with further liposuction, say at least a year after, if all the other modalities that you tried have not worked.
Thank you. Let's see. I know so many. Do your drains have to stay in for 5 days, or does it depend on the drainage output?
So I do use a drain for Lipo316 BBL, and those we'll get them out on your follow visit on post-op day 5. Yeah. So those will stay in for 5 days. All right. Now we're talking about tummy tucks. I also use drains for tummy tucks. I use 2 of them. And those can be in anywhere between 1 to 3 weeks, really, depending on the patient. So it's usually not that long. We can usually get the first one out in your follow-up visit here on post-op day 5. You do go home with the drain, and that one typically comes out a few days later. Not a big deal. Very, very easy to do. Our nurses can just kind of walk you or your caregiver through the process. So don't worry too much about that.
All right. I reached my 30 BMI today. Should I wait until my weight is stable to send pictures for a consult, or should I do it now so I don't have to wait longer for a surgery date?
So I think if you've gotten to the BMI of 30, go ahead and start sending that information in, because we do book fairly far out. September's almost all booked out, so we're looking into like end September, October right now. So yeah, and of course the more you wait, then the more you wait. So certainly go ahead and do that. And how do you do that for all you guys that are watching here? So you go to our website. You go to www.pureplasticsurgery.com, and in there you're gonna see a button that says virtual consultation. Go ahead and click on that button, okay, and fill out all the information. Send your photos, and then one of our coordinators will reach out to you.
Thank you. You got time for 2 more questions?
All right, let's do it. 2 more. Do we have any more on TikTok or no?
Oh, yes.
Oh, yeah. All right.
All right, let's see. Something.
Let's give them some different. Some TikTok love.
Something different. Let's see. All right, this is different. Do you have any advice for someone who wants to be a surgeon?
Oh, okay. All right, excellent. So the first thing I'm going to say is you gotta love it. You gotta love it, because it's gonna be a long road. Many years, a lot of sleepless nights, and fairly intense training. Okay, so if you don't love it, it's just gonna be torture, to be honest with you. Okay, I'm not sure what stage in your career you're at, but certainly once you're in medical school, you're gonna rotate through all the different specialties, and of course surgery is gonna be one of them. So see how you feel during that specialty, okay? If you're completely into it, you're like just feeling awesome, when you're in there, you're doing surgery, you're suturing, you're learning how to do your knots, etc., then certainly by all means, please go ahead and pursue that. I'm telling you, it's incredibly rewarding. It's incredibly rewarding, but just know that it's going to take you a long time. So for me, of course, I did 4 years of medical school. Then I did 5 years of general surgery training. I did 2 years of NIH funded research. And then after that, I did 3 additional years of specific plastic surgery training at Duke. Okay, so that's going to give you an idea of how long it's going to take to really go through that entire process.
All right, and then last question. Do you have any future plans now that you're president of the WAGS Association?
So for WAGS, yes, I have a lot of ideas, a lot of kind of future directions. But I think a lot of it, we kind of mentioned it here today. So I want first of all, I want more and more people, more and more potential patients to know about the World Association of Gluteal Surgeons, specifically patients that are, of course, looking for a BBL or gluteal surgery. It's a very specific society for that. So I want to make the name basically a household name to everyone that's considering a BBL. I want people to understand that the WAGS goals are very similar to our goals, here at Pure, which is first and foremost patient safety, and what can we do to make this procedure as safe for our patients as possible. Okay, and because of that, and because of course all the experience that our members have we do extremely well. We make this procedure very, very safe. Not just, and like I said, it's not just the U.S. So I think one of the kind of more difficult things when you're going, say, outside, when you're going to Colombia, Mexico, somewhere else, is to know, how do I know that surgeon's really, trained and has all the experience they need in this procedure? Well, one thing you can do is you can go to the WAGS website, go to www.gluteosurgeons.org and look at the member roster, okay? And then you see that, if someone's on there, then they're adhering to all these guidelines, okay, to make a BBL, let's say, procedure. So I think awareness is going to be huge. And then, of course, we're going to be starting, I think ultrasound is becoming more and more popular. I think it does add an extra level of safety to this procedure. And so we're going to be starting, basically the ultrasound, BBL ultrasound training. Like I said, this is going to be the pilot office here. And then from there, we can then, open up different centers, throughout the U.S. and also in other countries to continue to educate surgeons about using the ultrasound with the BBL. So I think those are two huge goals that we have for the next year or so. And then of course we want to talk about, whether your surgeon is a WAGS certified surgeon. And that's really it's gonna let you know that when it comes specifically to gluteal surgery, to BBL surgery, that they have the experience, they have the training, they have the ethics, okay, extremely important, to put patient safety as their #1 priority.
Thank you very much.
All right, everybody. Well, this has been great. I want to thank you all for joining me here today. I'm sure there's going to be more and more updates regarding all this coming up in the next few weeks. When and if those new Florida rules become ratified, we will let you know. Okay, just kind of look out for that in all our social media channels and the website as well. Okay, but otherwise, I will catch you all next week on Hump Day with Dr. Alex Earle. Take care, everyone. Ciao.